At the Global Liver Institute, we believe it all starts with a patient. So what happens when a patient, a liver patient no less, one of the 500 million people living with conditions that often go undiagnosed, untreated, or misdiagnosed, mistreated, and stigmatized, brings the challenges of liver patients front and center? And what happens when a patient then leads a discussion with world experts in policy, research, clinical care, and wellness on ways to overcome these challenges? Let's find out today on GLI Live. Hello and welcome. My name is Donna Cryer. I am the founder and CEO of the Global Liver Institute, and I am so excited to introduce you or reacquaint you with a very special guest who I feel is the absolute right person to talk about how to partner to put patient centricity into practice. And that would be the esteemed Emma Andrews, who's Vice President of Global Patient Advocacy at Pfizer. Welcome, Emma.
Thank you so much, Donna. I'm thrilled to be here. I'm finally a guest on the infamous GLI Live with your host, and I couldn't be more happier to be here and talking about a topic that's really honestly dear to my heart. So cannot wait.
Absolutely. As you know, many of the viewers and listeners know, we have not done a GLI Live for quite a while. And in part is because I've been spending some time being more patient than patient advocate. And during these past few weeks, one of the top thoughts that I've had is who has the scale, the scope, and the will to help us really take on the very large challenges that we have in healthcare. And so, you know, that's why I did not want to delay any further this wonderful conversation with Emma, or Dr. Andrews, I should say. I want to give everybody their credit and their flowers too. To explain what her role is at Pfizer, so other people know the really intentional, strategic work that she and her team are doing to support patients and patient advocacy in improving the healthcare system. So Emma, would you like to just describe like what your job is and maybe how you got there?
Sure. So thank you so much, Donna. And for those of you who don't know, I mean, a lot of colleagues at Pfizer have had a long history working with the Global Liver Institute. So I was thrilled when I finally met the infamous Donna over a year ago and welcomed her to be part of our Global Board of Advisors. And that was really important to us to have this Global Board of Advisors that were truly representative of patients from around the globe. We have representatives from Sub-Saharan Africa, from the Middle East, from Latin America, from North America, from Europe, etc. Because really at the end of the day, we wanted to make sure that our commitment to patients were not just for some patients, but for all patients. So maybe talking a little bit about my team and how we're organized at Pfizer. So I have the privilege and honor of leading global patient advocacy for Pfizer. So my team of about 35 colleagues in 17 countries is responsible to ensuring that we're embedding the patient perspective across everything we do, from the earliest moments in discovery to when a prescription is prescribed anywhere in the world. And Donna, I know you alluded to patient centricity when you started this conversation. So it was really important for us at Pfizer that this is not just a buzzword. So what does it really mean? So being Pfizer, we said, okay, let's look in the literature and see what they say. And it had already been defined. So it wasn't about redefining it, but putting it into context for Pfizer colleagues. Yeah. So what we did, we asked our colleagues, we asked our leaders, but then most important, we asked our patients through our patient advocates. And I'm really pleased with where we landed, because we say that patient centricity exists at Pfizer when we listen and learn from the patient perspective, when we act as partners with accountability and integrity to deliver outcomes that matter most to patients and those involved in their care. So if we're doing one or preferably all three of those things, we are being patient-centric. So to us, having that global board of advisors is bringing patient centricity to life, meaning that we're listening and learning from our patients and bringing that perspective back to help inform the way we do our work, the way we partner, the way we do everything to make sure that at the end of the day, what we deliver is going to be important and of value to patients and those who care for them.
Emma, I just want to underscore for our audience the sincerity of what you've said, and I have three really quick experiences with Pfizer that is the reason that I really invest the time to spend in partnership. One was when not only was I and several other patients working on some clinical trial protocols, but we understood that the protocols could not go forward unless the patient insights were incorporated in some way. So it was built into the actual operations. It wasn't just like, get the insights and then we'll ignore them and keep doing what we were always going to do. They could not go forward as a matter of your business practice until they demonstrated how patient insights were changed. The second is just how many people you have around the world recognizing that patients in different countries have different needs, have different patient advocacy, skills and resources, and really putting that the human resources and touch and connections available with such a large team. And I think the third is this new pan-therapeutic global board of the 12 of us, of which I'm so honored to serve, and the fact that we have access to you, we have access to the C-suite. It's not just we're put over sort of in a corner or siloed. That we know that we matter to the leadership and those who are making the directions, and that's allowed me to create a lot of trust amongst many communities who ask questions about vaccines or something. I'm like, well, I actually talked to the head of the chief medical officer, and I asked questions and I got answers, and they were like, oh, okay. And that has allowed me to move conversations forward and create such a well of trust that I wouldn't be able to do if you hadn't trusted us as patients and really invested so much so seriously. So thank you.
No, thank you so much, Donna, for saying that. And this is really something that Albert, Sally, and all our leaders at Pfizer really believe, because at the end of the day, when you think about our purpose, the reason we exist as a company is to bring breakthrough medicines and vaccines that change patients' lives. And that means what we do is for patients, we need to do it with them. And that's why we take so seriously this co-creation, this stopping and listening and learning from the patient perspective. And as I tell leaders and colleagues, is sometimes you need to go slow to go fast.
Yeah.
Because at the end of the day, if we are listening and learning and embedding those perspectives, what we're going to be delivering is going to be of value. So it brings me it's a hashtag Pfizer proud moment to talk about this patient advocacy leadership collective that was really as a result of us listening from our global board of our pan-therapeutic board of advisors. When we asked what was really important for patients and patient advocates, and what we heard loud and clear was around capacity building. Mm-hmm. Capacity building for that next generation leaders of patient advocates. So the Patient Advocacy Leadership Collective, that is really a result of this consultation, this co-creation, is really something that I'm so proud of. And the three pillars of that digital platform or Patient Advocacy Leadership Collective is one of them is the next generation leaders, meaning training and development for the next generation leaders. And the courses that these patient advocates can take are actually curated, again, by an independent faculty. They're the ones that can inform what is going to be in those courses, not Pfizer. Another one that is really important that you told us was all of you told us was really important, was around the mentorship. Mm-hmm. Now have the second pillar is a mentor match program, where a mentor can sign up with the skills they have and a mentee can sign up with what they need. So now, because it's digital, a patient advocate in Indonesia can connect with a patient advocate in Uganda.
Right.
A patient advocate in India can connect with a patient advocate in the United Kingdom. It's just so beautiful to watch. But now, and we had equal sign up of mentees and mentors. And then the third is us being able to deploy our most valuable asset, which is our colleagues, to do a time-bound, skill-based volunteering with a patient advocacy group. That hasn't been launched yet, and it's going to be limited to certain geographies. But again, that just shows that then we listened, we learned, and we've developed now this digital platform that's really available to everyone, is something that is of value to patient advocates and creating that next generation of leaders.
It is, and I will very selfishly say that it has helped me because, at this point in my career, I'm more coach than player, and so I am really invested in bringing up the next generation of nonprofit leadership, particularly those of color, and but my bandwidth is only so much. So. All three pillars are things that were on my sort of wish list of, if I had infinite time or resources, these are the things that I'd want to be available to other patient advocates. These are some of the resources that I'm privileged to have because I travel a lot to different countries or travel between different types of entities and stakeholders groups, hospitals or payers and things, and understand, and that I wish other patient advocacy leaders, had access to know to really, increase the impact of their work. And so being able to put all of these resources together at scale really is the sort of wish fulfillment for a lot of advocates, and is taking it's taking a huge weight off of of us who are trying to do things beyond just run our own organizations, but really care about the health of the field of patient advocacy and value that. So I really appreciate it from the. That's sort of an unexpected, perhaps, benefit of this, where I'm so excited because we know it's needed, but how do we find the bandwidth to do it? And so together we've been able to put these out.
Yeah, and thank you for being so vocal, because you're right. Like we're so grateful because you've been so impactful and you have a lot to share. But how can we bring it to scale? So thank you for being very vocal on this. And I'm really thrilled that we've now launched the Patient Advocacy Digital Collective and it's available. So I'm looking forward to really seeing more people get these nuggets of, actually, I always feel that this mentor-mentee relationship is actually it's both ways, right?
Absolutely.
You grow as a mentor and you grow as a mentee. So it's just really incredible. And I'm glad that we're playing some role in getting people connected.
And I think, one of the things that was surprising in some of the conversations that we had were what people wanted to be mentored on or who people wanted to be matched with. It wasn't necessarily, sort of within a traditional patient lane. There were a lot of people who expressed, I want to know more about venture capital, or I want to know more about regulatory, or I want to be matched or mentored with somebody who has done, grassroots. It's a really, I think, opening up with each other and with your team about, what type of things that we would really want to learn. And that's certainly how we operate in our GLI Advanced Advocacy Academy, asking people, what was your pain point in the healthcare system that you want to solve? And then how can we sort of upskill and match you with additional, tools and education and knowledge to then be more effective in solving those problems. But to be able to do that through this program for individual patients, for patient leaders, and for organizations is really exciting.
Mhm.
If we say that it all starts with a patient, we can only be as effective as the tools that we have and the ways that we understand how all these parts fit together. And so I think this will really usher in a new age of patient advocacy and the sophistication that we need to bring to this changing healthcare ecosystem.
Thank you, Donna, and thank you for your part in this, definitely. Yeah.
So one of the wonderful things about the leadership group and all the work is how diverse we are, certainly geographically, ethnically, in all ways. How does this program and your work in general help improve equitable access to healthcare and to knowledge?
That is so important. And actually, when we think about Pfizer, one of our four core values is equity. So one thing I say is that it's not just going to happen by serendipity. You have to be intentional. You really have to be intentional to make sure that it's embedded across everything we do. And that's what we do. So when I set out about thinking about patient centricity at Pfizer, equity was at the forefront. And that meant that it's not perfect, but I want to make sure that our board of advisors were representative of the globe. So ideally, it would be great to have an advocate from each country, but this is the next best thing, meaning at least we have representation from every part of the globe. And that way, when we say we're being patient-centric, it's not just for some patients, but it's for all patients.
Right.
Because we have that representation, and you guys hold us accountable to that.
We do. It's a spicy group. We're not quiet. And I think one of the main insights is that advocacy is perceived differently, received differently, and conducted differently in different parts of the world. In U.S., there's sort of a long history of very sort of vocal, strong, upfront advocacy. In other countries, the governments look only more to the doctors, and it's harder for the patient advocates to get credibility. And so being able to solve those issues in context, in culture, for patients, so that there aren't just gaps and sort of advocacy deserts, if you will, and that everyone in every country or every part of the world has a strong patient voice, and understands how to use it and to leverage, and can get help from in examples from other parts of the world to say, well, here they are able to get this done and maybe be more persuasive, in their own countries. But just that sort of awareness that it's perceived in different ways and that there are different obstacles and challenges, I think helps us all be better partners to each other, and it reinforces our commitment to our fellow patient advocates.
Yeah, and I think that's really well said, because at the end of the day, one thing that we've learned as well from all of you is that we need to meet communities, we need to meet patients where they are.
Right.
What works for one is not going to work for the other, but how, and also who are the right partners to deliver that message. So that has been really has been a great journey and partnership and collaboration, because that's how co-creation works.
What has been the most surprising thing to you?
The most surprising is that equity means different things for different people.
Right.
In some countries, in here, in the US, it's really around this institutionalized racism. How can we make sure that everyone is represented? In Kampala, Uganda, it's simply about, how can I get that medicine I need? How can I get just access to healthcare? Simple access to healthcare. So it's really, for me, it's been an eye-opener to know that equity looks different in different jurisdictions around the world. And working with our board of advisors helps us really meet the different patients and patient communities where they are.
I think that's that's certainly been my experience. I challenge my team
Mhm.
to think about solutions that'll work from, I usually say, like from Seattle to Senegal,
I love that
or
one.
maybe I'll
I
say
might
from
steal that one.
Utah to Uganda. And so, um, because if it's great if something and an innovation is accessible in the US, but if it's not in Africa or Asia, then I really feel we're not serving our global patient population. And I
Mhm.
also feel like there is so much for us to learn from our patient advocacy partners and community leaders in other countries
Mhm.
who have had to be extremely innovative and resourceful.
Mhm.
And I've found several of those uh, solutions that they've created are really applicable to some rural areas of America
Mhm.
or other things. And so I do think that coming in as an American, we think that we're always sort of giving advice and everything, and it's important that we take it
Mhm.
as well
Mhm.
and really reset our perspective since our diseases and conditions are global. That we need to be listening and be really sensitive to what are the strengths that other countries and other advocates can bring to this problem to
Yeah.
solve them uniquely.
Yeah. And that's why, Donna, to me, I give, like, I would say, a shout out to patient advocates, because really, I think the work you do is so important and critical, because at the end of the day, what you are doing is empowering patients. And I think when I know there's something that I was thinking about, what's the future? I think
Mhm.
for me, moving from just simple patient engagement to patient empowerment is really the future. Because I really think that an empowered patient will show up differently,
Mhm.
whether they're meeting with us, industry, whether they're meeting with their healthcare professional, whether they're
Mhm.
meeting with regulators, they'll be empowered into being really leading their shared decision making about their health. And you
Right.
will have improved patient outcomes.
Absolutely. One of the things that I have appreciated, as you mentioned in my long history of working with Pfizer,
Yeah.
was the focus on health literacy. Because I recognize that you can't have real shared decision making if you don't have literacy, health literacy, and then increasingly a sort of digital
Literacy.
literacy.
Yeah.
And so and that also needs to be in language. So how are we, I was like,
Yeah.
not just you, how are
Yeah.
we working to address, to make sure that certainly all the resources that we are putting out through this new initiative um, are accessible to people with different languages and literacy levels, and really helping them to bring up so they can be empowered and have enough knowledge to ask a good question or to
Yeah.
participate in shared decision making.
Yeah. So one thing that I'm really proud of is our health literacy efforts. And I'm really pleased to say that I was one of the co-founders of the first working group, health literacy working group, that then became a community of practice and has now
Mm-hmm.
flourished at Pfizer.
Yeah.
And really, we believe, I believe health literacy is a modifiable risk factor.
Yes.
It's modifiable. So what
Mm-hmm.
you have to be, health literacy simply means that we have to be able to talk to a patient in a manner that they can understand and lead to activation.
Right.
So some of the things we've done at Pfizer is make sure that, for example, our data, our clinical data, our publications are written in plain language summary. We've started that initiative. It's not yet 100%, but we're definitely working towards that. And also returning data to patients, again, in a manner following health literacy principles, in a manner that they can understand and lead to activation. So those are tangible things that we're doing at Pfizer, and also making sure that all our content, our patient-facing content, is written following health literacy principles, and that our colleagues who are in patient-facing roles
Mm-hmm.
have clear health literacy training.
Wow.
So to me, it's just fundamental of who we are. Like, we have to be able to talk about the benefit risk profile of our medicines in a manner, or offer healthcare professionals tools that they can use, because they're the ones who are having these
Right.
conversations, in a manner that patients can understand and that lead to activation.
I think that those are fantastic examples of how you've operationalized these issues rather than just talking about it. If everyone needs to be trained in this, I think hopefully people are taking a lot of notes and ideas because I sit in a lot of waiting rooms or go through exhibit halls and edit a lot of a lot of stuff and interpret a lot of things for patients, and I'm often struck thinking, I'm like, gosh, I have multiple degrees and emeritus physician. If it's this hard for me to understand what this is, other people are just not able to do it.
And I think I forgot to mention that right now it's only available in the US, but we hope to really expand. Part of the Patient Advocacy Leadership Collective is the Clear AI health literacy tool. So this is going to be made available to all patient advocacy groups in the US and hopefully soon everywhere else. You can use this tool to help make sure that your materials are also written in a manner that patients can understand and lead to activation.
I think that's fantastic, and leads us into the next question about what is the future for Pfizer in patient advocacy going into 2024.
Yeah, and I think I alluded to it earlier a bit, Donna, but to me, really, it's around this whole patient empowerment.
Yeah.
We have to move from just engaging patients to really making sure that patients are empowered, because the magic happens then.
Right.
Magic happens when patients are empowered.
What can we do to help prepare our physician colleagues for an empowered patient? Some do better than others.
Yeah.
But I think that there is I know from various partnerships I've had with many physicians and principal investigators on trials and various things, that there is an incredible synergy when patients and physicians can work together, whether on their individual care or on projects. Are we sharing this enthusiasm and bringing our physician colleagues along with us, lest we just bring people on them?
No, absolutely. And listen, we all know, especially in the US and probably in jurisdictions around the world, how limited the physician's time is with patients. Right. So what tools can we offer? How can we partner? Is there a way we can use digital tools to make sure that interaction, that very important interaction with HCPs and patients, happens in a manner that patients can understand and lead to activation? That discussion that happens with physicians and patients, or HCPs and patients, is so important. So are there tools that we can give? Are there ways we can partner, collaborate to make sure that they have what they need to make sure that when they're talking to patients, they can clearly understand, and that will then lead to activation and empowerment?
I think we can also work on how patients present information to physicians so that the physicians are empowered and activated.
That's true. How can you prep? How can you prep for the visit, right?
Yes, exactly. Emma, thank you so much for this conversation and this opportunity to be part of this patient leadership group. It's really been it's always exciting for me to be able to continue to learn, to continue to be better and improve in my advocacy. And so the opportunity that you have created for both growth and service is really unique. And so for that, I'm grateful.
And thank you so much, Donna. I'm grateful as well. And also on that continuous learning journey as well. And I'm also thrilled that I was finally invited on a guest on the GLI Live, so I can check that bucket now. Just, that it's done. Bucket list check done. So thank you so much. And thank you for the incredible work you and your team are doing at GLI.
Thank you so much. And all the information that is now current we've been discussing will be included in the show notes. And so for everybody watching and listening, thank you so very much, and see you next time.
Thanks, Donna. Take care.
Please be sure to like this video, subscribe,
and share your thoughts and suggestions in the comments below. Join us weekly on Wednesdays at noon Eastern Time for more episodes of GLI Live. Check out our website, globalliver.org, and follow us on social media to learn more about the Global Liver Institute and stay up to date with the latest in liver health. Until next time, stay safe, stay well, and stay connected.